The following segment is sponsored by Selkie Financial Group. Many of us worry about how we're going to afford retirement, but what happens if we need long-term health care in our old age?
Luckily, Jeff is here, our resident financial wizard. That's what I'm going with.
That's a good one. I like that.
Everything.
I need to bring my wand next time.
Yes, please. Well, none of us want to plan on going into like a facility that we're going to need care and things like that, but the reality is that a lot of us are going to need that as we get older, and it can cost up to $10,000 a month. I had no idea.
It's crazy, yes.
Wild.
It can wipe out your wealth, your savings. And the Department of Health and Human Services, that's our federal government, says that 70% of us over age 65, so as we get older, 70% of us will need long-term care.
Wow.
That's a lot of people.
That's
scary.
A lot. So basically, if you live long enough, you're going to need care.
Yeah.
And that could be care in your own home, that could be care in an assisted living facility, or that could be, heaven forbid, care in a nursing home. And the reason most people don't want to go to a nursing home, it's not that they're bad places, it's just that that means you need a lot of care if you get to that point.
Right.
And it's really expensive. That's where you're paying $7,000, $8,000, $9,000 a month.
Oh my gosh.
Well, and it doesn't matter how well you planned, when that gets landed on your lap, you're probably going to run out of funds. It's just so scary.
Let me tell you a situation. I have a client who, her husband got really sick, ended up having to go into a nursing home. He had Alzheimer's, was running away from her. She couldn't do anything about it. So she had to put him in a nursing home. The cost, and this was almost 10 years ago, the cost was $7,000 a month. Now think about $7,000 a month. That's a lot of money. That's over $80,000 a year. She had about $350,000 of total savings for retirement.
Wow.
If he lasted for about 4 to 5 years, her savings is all gone. All gone, and she's broke, left alone.
Well, and Jeff, as much as we hope insurance will cover it, they don't always cover everything, right?
That's true. So it depends what kind of insurance you have. So a lot of people think that Medicare will pay our bills in retirement, that they'll pay for healthcare needs. They pay for doctor visits and hospital visits, but they don't pay for nursing home costs.
Ooh, good
the
to
only
know.
way the federal government's going to pay for your nursing home care is if you're on Medicaid, which means you're broke. If you've spent all of your savings, all of your income, then the government, Medicaid, will pay for your nursing home. But you don't get to choose where you go, and it's a semi-private room, which means you're probably sharing a room with somebody, and so you don't have a lot of choices. So most people don't want to get to that point, right?
No.
And so we've got to do some planning ahead of time to protect ourselves. So especially, this is really important. We can look at this at any age, but it's really important as we get closer to retirement. For those who are in their late 50s, early 60s, 70s, that are retiring or thinking about retiring, it's a good idea to do some planning on this in this area to make sure you're protected, to make sure all your hard-earned wealth, all
you gotta
this money,
keep it all.
And that's how you can help us, right?
Yes, make sure it doesn't go away. There is insurance. There's something called long-term care insurance that you can purchase.
Oh, good.
That will protect you and pay for home health care, nursing home care, assisted living care, and help pay some of the bills so that you don't have to spend all your own money, so that you can preserve your wealth for yourself and for the next generation, maybe to leave it to your kids.
Oh, and you can give a free guidebook as well, right?
That's
now,
right. Yep, so I've got a free guide talking all about long-term care, what you need to know about it, the costs, and what you can do to protect yourself. And if you have somebody who is in a nursing home or getting close to that, maybe your mom or dad, there are things you can do to protect your wealth right now. So give us a call. We'll have a free visit to talk about what you need to be doing.
This is
Thank
why
you
we
so
trust
much,
you,
Jeff.
Thank you.